many of you are familiar with the Bladder Meridian if you're working on your animal's top line already. We're going to introduce you to a classification of points that we use as our beginning assessment process and our beginning work with the points, known as the association points or the AP points. The association points are attached to the 12 main meridians. And in this module today, I'm going to take you through the TCM as complementary modality, the acupressure and meridian massage techniques, introduction to food, 5 elements, 12 meridians, with some focus on the acupoint classification association points and why we use them. A concept in traditional Chinese medicine, it's called the law of integrity. First of all, I want to say, always believe what you see and trust your intuition. Secondly, the law of integrity tells us that what is ever on the inside of the body will be reflected on the outside. So with our observation and with our studies and with our knowledge, we will be able, through the history and through our observations, our eyes, our ears, our nose, and that verbal history, to know where we might need to go on the animal to help build a better connection. The association points are found between the 8th and the 18th rib of the barrel, and then up in the lumbosacral region along this top line. There are other points along the bladder meridian, and we'll discuss those, and we'll show you those in our case study demonstration when we do the full protocol. But for now, I want to introduce you to these association points so that we can get connected to the horse and go beyond the bladder meridian. So we've done our bladder opening, and we did see that she was sensitive in the hind end zone with some tension there. So after my opening, I'm going to go ahead and do my point work. And that will be on the association point for pericardium and heart. We do our point work. We can do that through 1-finger point work, 2-finger, or thumb. I like 2-finger. I feel more stable there. Again, depending on the size of the horse, you might be able to come in at 90 degrees, and she's reacting even though I'm using very little pressure at all. Or you can come in at 45 degrees, whatever's comfortable for you. So I'm in my front zone, finding that 8th rib, backside of the wither. I'm finding my lung point, and then pericardium. Nice big breath out there. Lick and chew. Holding. The amount of pressure we talk about is up to 3 pounds, starting with 1 pound. I start with the lightest pressure, and as I sink in, I do it with my breath. So I take a breath in, and then I breathe out, sinking in. 2 pounds. Breathe in, and out, sinking in with my exhale. The intention is as important as the work that you do. You can see that Maya's pretty relaxed and quiet with her pericardium association point work. I'm going to stick with it for a minute. How do you know when it's time to get out? Well, you just have to decide that you know when you know. You might feel a change, a subtle change. The horse will usually tell you. She's really sticking with it. Really nice big belly breaths. You can see her expanding. How's she looking up front? Pretty relaxed. A little bit tension in the eye. I'm going to hold the point again. Breathing in and out. After I've done the work on my pericardium association point, I'm going to just slide my hand down along the pericardium or the girth line and connect with the pericardium point underneath her girth line. And you can tell that was a little bit more confusing for her. So I'm going to repeat my point work 3 times. Holding. Breathing. And when I'm ready to release, I'm going to just follow the point down and off.